Hello, welcome to the Aga Khan Hospital, Mombasa. Today, I'll be taking you on a short journey.
Resident physician and cardiologist at the Aga Khan Hospital, Mombasa. And I'm here to present the myths and facts about vaccination. There have been a lot of discussion, especially through the social media, through the internet, and many other venues of communication about issues of vaccines and all that. So today I'm here to, in my capacity to sort of make the facts clear and sort of set things right.
To our viewers, maybe I can let you know that recently Dr. Swaleh went to Dubai, and I know he's very good in Arabic. So Dr. Swaleh, maybe you can tell us just briefly how was Dubai and introduce yourself maybe in Arabic if you don't mind.
I think most of viewers are comfortable with English and Kiswahili, but basically I had the privilege of visiting another country after a very long time and sort of see the experience in other countries. I was actually very interested and very excited to know what is happening beyond the borders of Kenya, because since we had our lockdowns, we had the airline industry shutting down and all that, we've been sort of put like pets in a cage where we don't see what is outside there. So I had the privilege of visiting Dubai, and I was really impressed that people have opened up to their economies. People are trying their best to go back to their life. Restrictions are there, masks are there, and restrictions are not only followed, but the law is making sure that the precautions that are supposed to be followed are actually followed by the people. So I was impressed to see that the malls are full, yet the restrictions are there. I was impressed to see that the hotels, people are eating in the same dining hall, but you could see that the efforts have been done to maintain distance, masking and sanitization was all over, and sort of even getting your test done has been sort of demystified, where you just need to drive with your car and get your self-test done, and within 10 hours you have your results before you even travel back home. So yes, we've been having corona since 2019, end of 2019. Life has never been back to normal, and I think that is the question everybody's asking. When are we going to get back our life? When are we going to get out of this cage life like pets? So one of the ways, based on the previous experience from other pandemics, like the smallpox pandemic, the plague pandemics, the measles, vaccines came to our rescue to sort of bring normality to life. So we're also hopeful that with the COVID vaccines, we should be able to reduce the transmission. We should be able to go back to our life once a critical number of the world population has been vaccinated to attain something called herd immunity, probably 70% and above. Then we should be able now to sort of eradicate this disease from the face of this earth.
Thank you, Dr. Swaleh. So, on to today's topic, debunking the myths of the Covidshield Astrazeneca vaccine. What's your take on that, Dr. Swaleh?
I mean, historically, we can see the fear where it comes from. One is that these vaccines have been sort of developed in a very fast manner. If you look conventionally, the previous vaccines, they used to have almost like three phases of three phases of research and preclinical research before they go into the human research. And usually they will take years before a vaccine is approved. But for the COVID vaccines, the race started quite early, and we're already seeing the vaccines within 1 or 2 years are already being rolled out. And people are wondering, how come this one does not follow the usual conventional way of taking that? But I can tell you, there have been a lot of overlap, where people are doing phase 1 at the same time phase 2 is being done. People are doing phase 2 and at the same time phase 3 is being done. And the simple reason being, this is a pandemic and emergency. And not only that, mind you, people have had experience recently from the SARS-CoV-1 vaccine pandemic, not pandemic, but epidemic, and also from the Mediterranean virus and vaccines were developed. So we have the platform for the coronavirus vaccines from these two epidemics that had occurred recently. And using those platforms, we can see now there's a race to come up with effective vaccines so that we can be able to contain the COVID-19 pandemic. And as we are talking right now, there are almost more than 140 registered preclinical trials on vaccines, and 40 of them have gone into the human phase trials. And up to now, we almost have 7 to 8 vaccines that have been approved all over the world. And as we speak right now, there are more than 600 million people who have been vaccinated. In Kenya, we have almost reaching 500,000 people who have been vaccinated in Kenya. But all over the world, we have more than 600 million people who have been vaccinated by different vaccines. Now, the fear comes in that the vaccines have been manufactured or have been prepared very fast. And that's understandable. But in my understanding, on my capacity, the reason for that is that this is a pandemic that has really affected our life. Now, never before had we had such a great pandemic to have actually bring life to a standstill, where people cannot move, where people cannot, most of the economies have been crushed, where people are not back to their life. You cannot even visit your own parents sometimes in fear that you might infect them. So our life have actually been interfered, and we have all been medically and psychologically affected. And that's the reason now we have to move fast to get back our life. So yes, the vaccines, the research that has actually been produced in the last few years can never be matched with all the research that has been done before. We have seen a lot of research on COVID because of the need for us to go back to our life. It's human. We want back our pleasure, we want back our happiness, we want back to be ourselves. And that's the reason why things have to be rushed so that we can get somewhere there close. And there have also been issues, some of them are genuine issues where we've had issues with certain vaccines. And I'm going to talk notably with one of those vaccines, what we call the Astrazeneca vaccine. And this is the one that most of the Kenyans have gotten it. And I think in the country we have another one called Sputnik from Russia. We don't have the Pfizer or the Moderna or the Johnson & Johnson and the other ones. But so far, the main vaccine that is circulating in Kenya is the Astrazeneca. Now, there have been issues with AstraZeneca. Some of them are genuine issues, and some of them are actually more of myths. Like we've had issues of allergy, and this happens so for those patients who already have history of allergy, and there's a very clear sort of warning for those who already have previous history of significant allergy. Then those type of patients have to be really observed if they have to get the vaccine, especially for the first half an hour post-vaccination. There have been issues of, I'm sure there have been other issues of patients getting vaccine-related disease, where patients after some 1 week or 2 weeks, they do develop COVID. Now you wonder, is it the vaccine that has given them the COVID, or what is it? So these are the things that I would like to discuss today. And the other thing that I needed to discuss, which I'm sure is important for most of us, is the issue of clots associated with the AstraZeneca, what we call thrombosis. And yes, there have been quite reports of clots. I think if I remember very well, there have been cases of around 100 or 200 and something in combination of thrombosis in those patients, and almost occurring in 68 million people who are vaccinated. So this is genuine, it's a very rare condition, but it occurred. And it raises issues that, was it coincidental with the vaccine, or was it something that is not related to the vaccine? One thing is the occurrence is quite low. We are talking of around hardly 200 people in a population of around 60 million people, or 68 precisely million people, who got that, who got those rare effects. And those rare effects presented like clots in the head, what we call venous thrombosis, and some of them clots in the vessels of the abdomen, what we call splanchnic thrombosis. So they occurred, and they raised the issue and the red flag that is there a coincidental relationship between the two. And some of the countries actually, they did stop issuing the Astrazeneca vaccine to their citizens. Some of them did not stop. Majority did not stop. Some issued some criteria, like countries, some countries like European countries, some of them have issued criteria that the AstraZeneca, if there's another alternative, should not be given to people who are under 60 years. And in Canada, specifically, they've said they are not giving the AstraZeneca to people who are less than 55 years. So this is a genuine concern. It is rare, because if you are to look at numbers, 200 out of 68, then that occurrence is very rare. It occurred mostly in women and those below 60 years of age. So apparently, it wasn't very common in the elderly. It wasn't very common in the male gender, but more common in women and those under 60 years. Now, the question is, a lot of our population has not been exposed to COVID, especially even the elderly population. Now, we are seeing a lot of morbidity and mortality associated with COVID, a lot of hospitalization, especially to the elderly people, a lot of deaths, especially to the elderly people. Now, if one was to weigh the benefits vis-a-vis the disadvantages or the side effects of this vaccine, then majority of the authorities, including World Health Organization and including other like European Medical Agency, they still advise people to go for the vaccine, simply because the benefits outweigh the disadvantages. The disadvantages are very, very rare. They do occur. We have to be on the lookout for them. Any person who reports severe headache, especially 7 to 10 days after the vaccination, then that warrants investigation. They should go to the hospital, have themselves checked. And this particular disease, we think it's autoimmune. And if we speak early, so probably something can be given to salvage the situation. We know that the platelets go down. We also know that they form clots in the head. They can form clots in the arteries supplying the intestine. So they might present with severe headache, crushing headache that does not improve with just painkillers, or severe abdominal pains. So in that case, especially 1 week after the vaccination, then people should rush to the hospital for evaluation. Other side effects that we see with this vaccine are local side effects where you get the injection, because these vaccines, most of them are given intramuscular, and sometimes they evoke a local reaction on the skin, and they can also give you some what we call constitutional symptoms like fever, fatigue, especially fatigue, excessive weakness that you don't feel like you have energy. But this joint pains, some of these things, they actually occur quite early post-vaccination, probably 1 to 2 days after the vaccination, and they're short-lived. They sort of just disappear with rest, and once in a while we can use our paracetamol to alleviate the symptoms. And the other thing will be, people have talked about the efficacy of the vaccines. What do the vaccines? We've always have our hopes on vaccines. We have successful stories on vaccines in certain epidemics, previous epidemics that we've had. I've mentioned about smallpox. Okay, so we would like to believe that through the vaccination we'll be able to reduce and sort of be able to control transmission, because vaccination really helps us in 2 ways. First, it protects the person who has been vaccinated. It protects against usually 3 things. It doesn't protect you from getting the infection. And the vaccination gives you the best outcome 2 weeks after you have given the full dose, which most of the time with AstraZeneca, it's 2 doses with 8 to 12 weeks apart. So once you have received your second dose and 2 weeks later, then only then can you claim that you are now vaccinated, fully vaccinated. And then you are protected now from the severe form of the disease. So the vaccine doesn't prevent you from getting mild to moderate disease. What does that mean? It means you can still get the infection, and precautions have to be taken until we gather more and more evidence and more people get vaccinated and more and more people get immune, so that once we get to that critical herd immunity of 70% and above, then we'll be able to control this disease globally. But despite having the capability of getting the infection, the rate is very low compared to somebody who has not been vaccinated. So the vaccine has two important aspects. One is to protect the person who has been vaccinated, but also more importantly is to protect the other person who is not vaccinated from this person. So definitely we are going to reduce the transmission rate in the population from person to person, and in doing so, we'll be actually sort of controlling the prevalence and the rising incidence of the disease. One thing for sure, the efficacy of the vaccines are different. If you compare the vaccines, literature has talked of 95% with some vaccines, and certain vaccines about 72% and 80%. And I would love to leave this efficacy rates to the science world, because there are many questions that we can ask ourselves. These trials are not done on the same circumstances, on the same population of people. They are done at different circumstances and different times. The Pfizer and the Moderna were done in the early stage of the disease, where we did not have these mutant strains like the Brazil, the UK mutant, and the South African mutant. So, and if you look at others, they're done during this stage where we have the mutants. So the interpretation of efficacy, we need to be careful to say, maybe this is more efficacious than the others. But one thing for sure, all the vaccines have done, they have prevented severe disease by 100%. They have prevented hospitalization by 100%, all vaccines. And they have prevented COVID-related mortality or deaths by almost 100%. So definitely we are seeing, and that's exactly what I want. I just want to be safe. I don't mind getting a flu, but I want to be safe. I don't want to be admitted. I don't want to have severe disease for me to stay at home. Or I don't want to have severe disease for me to get ventilated or be taken to life support machines. So one thing for sure and consistently all these vaccines have done is to prevent these three aspects of severe disease, hospitalization, and COVID-related deaths. Now, coming to question which I'm sure some of the audience will raise is the issue of the mutant variants of the COVID-19 virus that are being noted in places like Brazil, UK, and South Africa. And certain vaccines have been found to be sort of fully not really active against them, or the efficacy has really gone down for those type of patients or those type of population. And it is true, we are still getting a lot of information coming out. We know that certain vaccines also have efficacy, have some, they're efficient to those type of strains. And how will these strains affect the success of these vaccines? And I think some of those questions might not have them now, but we'll have them very soon. And as I said, we have around 7 to 8 vaccines so far that are circulating around globally, but we do have a lot of vaccines in the human phase trials, almost like 40 that are coming up.
Thank you, Dr. Swaleh. I'm seeing lots and lots of questions in regards to the vaccines. And what I can say is that we are very lucky to have with us Dr. Swaleh. He is our resident cardiologist and head of our cardiology department. And please feel free to ask as many questions as possible in regards to the vaccine. Dr. Swaleh, we have questions from Kellen Eshimuli. My question to you is, do you first have to assess the person before the vaccine? If I had COVID, do I visit the hospital once cured, or how long does it take to be vaccinated? I think what he's asking is, do you first test for the vaccine before administering?
You test for the status of the vaccine.
For the status
if it has been exposed to the COVID.
Yes, exactly.
Yeah. You don't need to do that if you have obvious symptoms like fevers, cough, or any symptoms with fevers and or cough or difficulty breathing. At that particular time, it's not advisable for you to have the vaccine. But it's not mandatory, not in Kenya, not all over the world, to have yourself tested for antibodies before you get the vaccine. The reason being, even those patients who have been infected with COVID are still recommended to have the vaccine. So the recommended time once you've had COVID, 2 weeks after you have sort of recovered from COVID, then you can go ahead and have your first jab of the vaccine for those who are receiving the 2 doses, which we have in this country. So, okay, so you don't need to test for any antibodies, you don't need to do any tests. I mean, of course, precautionary for those patients, as I said earlier, who have a history of allergy, especially significant allergy. Then those type of patients, we need to be careful, not just, we don't give them the vaccine, but we need to observe them immediately for what we call immediate allergic reaction. And there have been issues about eggs and proteins, but we do know that all these vaccines do not have any human or animal proteins. So there's no egg in this vaccine, there's no human particles in this vaccine, so they can go ahead, but as I said earlier, they need to be observed immediately post-vaccination in the first 30 minutes, and if anything happens, then anti-allergy medications can be instituted as early as possible.
Thank you, Dr. Swaleh. To our audience, I believe we are now at the question and answer session. We have seen all your questions. Wellspring has just suggested COVID test is very expensive and makes it difficult to know your COVID status and management in the country. He has suggested, why can private hospitals reduce tests to Kenya shillings 2,000, at least so that we can have more people coming out for the test. So we've noted your comment, Wellspring, and we'll allow Dr. Swaleh to answer, to comment on it once he takes a short break. Let's allow him to have a sip of water. Okay, he's fasting. So let's give him a 2-minute break, and then he'll be back shortly, Wellspring, to answer your question.
Hello, welcome to the Aga Khan Hospital, Mombasa. Today, I'll be taking you on a short journey of our hospital to give you an insight into our COVID preparedness plan to see how you can be safe while you visit our hospital. My name is Dr. Irfan Samji, and I'm the Quality and Patient Safety Physician and the Infection Control Liaison at the hospital. When you arrive at the hospital, your first point of contact will be with our very able security team. These individuals will walk you through a hand hygiene process that will keep you even safer as you come into the hospital. Remember, clean hands are safe hands. Your next point of contact will be at our central triage point. As you walk into the hospital, you will find a structure that we have put up where we have some dedicated nurses who will check your vitals, including your temperature, your blood pressure, among other things, but also ask you about history of travel or contact with anybody who may have symptoms of COVID to be able to identify your next point through the facility. Once you have been screened by our nurses, they will be able to determine whether you may be a COVID patient or not. In the event that you don't fit a case definition for COVID-19, you will be free to continue with your journey through the facility. This means that you will be able to proceed either to see your doctor or to collect medication from the pharmacy or to continue with any blood work that you may have come for.
We are basically ongoing. Our activities are not hindered by the COVID-19 infection. However, we are taking extra precautions. Our medical staff are donned, just like I am, with full PPE kits. We are also adopting social distancing. Our patients are distanced at the reception at least 1.5 meters apart, so that to minimize any potential infections. We are also screening our patients coming. However, I'd like to say that the services remain unhindered and that we are running as usual. You are always welcome to visit us in any of our 8 outreaches within the coastal region.
At this point, let me also remind you all, we have put in place teleconsultation services to ensure that our patients are able to access our services safely from the comfort of their homes. Hello, welcome to the Aga Khan Hospital, Mombasa. Today, I'll be taking you on a short journey of our hospital to give you an insight into our COVID preparedness plan to see how you can be safe while you visit our hospital. My name is Dr. Irfan Samji and I'm the Quality and Patient Safety Physician and the Infection Control Liaison at the hospital. When you arrive at the hospital, your first point of contact will be with our very able security team. These individuals will walk you through a hand hygiene process that will keep you even safer as you come into the hospital. Remember, clean hands are safe hands. Your next point of contact will be at our central triage point. As you walk into the hospital, you will find a structure that we have put up where we have some dedicated nurses who will check your vitals, including your temperature, your blood pressure, among other things, but also ask you about history of travel or contact with anybody who may have symptoms of COVID to be able to identify your next point through the facility. Once you have been screened by our nurses, they will be able to determine whether you may be a COVID patient or not. In the event that you don't fit a case definition for COVID-19, you will be free to continue with your journey through the facility. This means that you will be able to proceed either to see your doctor or to collect medication from the pharmacy or to continue with any blood work that you may have come for.
We are basically ongoing. Our activities are not hindered by the COVID-19 infection. However, we are taking extra precautions. Our medical staff are donned, just like I am, with full PPE kits. We are also adopting social distancing. Our patients are distanced at the reception at least 1.5 meters apart so that to minimize any potential infections. We are also screening our patients coming. However, I'd like to say that the services remain unhindered and that we are running as usual. You are always welcome to visit us in any of our 8.
So, to our viewers, thank you for asking the questions that you've asked. Dr. Swaleh, Jacinta Muihaki has asked, if one is 44 years old and has had a clot before, that is PE, which actually left a dilated artery, is the person safe to use the vaccine? Or is there a high chance that they could develop clots due to the vaccine? Dr. Swaleh.
Okay, as I said, with the principles are, we might not have the privilege of getting the choices of the vaccines that are available. The choices so far we have in Kenya, I think that is available free of charge is the Astrazeneca. Even the Sputnik, I think it has not, the Ministry of Health has not given clearance for its distribution or for its use in Kenya so far. So the principle of the matter is, whatever is in front of you, the first one, take it, because you might never know that you're going to get another one. There is a huge scramble for vaccines all over the world. The demand is quite high, and the sort of supply is not matching the demand. And that's why even companies are subcontracting everywhere globally, so that we can have these vaccines available to the population. Now, you have a genuine concern. You have had a clot before. And the AstraZeneca, as I said, the word most likely should not be used because the clots happen in 160 out of the 34 million people who are vaccinated. And if you look at the occurrence, we are talking of almost like 1, 2, and if you look at the natural occurrence of these diseases like pulmonary thromboembolism, diseases like cavernous sinus thrombosis, these clots, diseases like the deep venous thrombosis, their natural occurrence themselves are more than what was seen in the vaccinated population. So if you compare, if you are not giving any person that vaccine, will this disease occur? Yes, this pulmonary thromboembolism, we have always treated pulmonary thromboembolism. Even the person is asking the question, you got pulmonary thromboembolism even before you got the vaccine. So these diseases exist, like deep venous thrombosis, pulmonary thromboembolism. It was just an occurrence that was noted, and it raised concern that is there a causal relationship between the two. So far, the scientific world has not related the vaccine to be the cause for that. But it's a concern in the sense that it was noted. So for somebody like you, one of the things is one could think of, if you had an alternative to get another vaccine that is not AstraZeneca, then go ahead and get another vaccine which is not AstraZeneca. The other thing is, if you have no other option and you have to get the AstraZeneca, then you're that type of a person. I'll be very observing, and you'll have to be observant yourself. The danger signs that you're supposed to watch are things like, one, if you develop some rashes, red rashes or pinpoint rashes on your skin, if you develop severe headache, especially around 14 days after vaccination, that's the common occurrence, but it can happen even before. If you develop any unusual feeling like difficulty in breathing, new onset, if you develop like a swelling in the leg, then you're the type of a person that you should rush to a good hospital where they should be aware that you have been vaccinated. And in case the worst scenario is you got a clot, then evaluation should be targeted towards diagnosing that clot, and immediate treatment has to be offered. But first of all, as I said, if you have an option of getting another one, please go ahead and get another vaccine. In the event that you have to get the AstraZeneca, then you just need to be on a close observership. But I will not panic for that. And sometimes my patients, we don't have evidence to suggest that, but I usually put them on blood thinners for those who have had a clot before, even before they get the vaccine, okay, to prevent that clot from forming. I don't have any scientific evidence to do that, but as I said, we are in the early stages of the disease, and we are waiting for more data to come for us to be able to give you the right advice.
Thank you, Dr. Swaleh. Jacinta, I believe your question has been well answered. Wellspring has commented, I will wait for the nasal vaccine that is being developed. I understand it is able to stop COVID and build immunity than being injected by the vaccines which cannot be trusted. Do you have a short comment on that, Dr. Swaleh?
There are two aspects of that question. One is the international, and the other one is the trust with the existing vaccines. The international one is still a research type of vaccine. Our anticipation is that it will be able to evoke a local immune response on the respiratory system, as well as a systemic, because we don't want just a local response, we also want a systemic response. We want the body to be able to produce antibodies, and we also want the body to have what we call the B memory cells and the T memory cells to be able to evoke a very good immune response once it has been exposed to the COVID-19 virus. So the intranasal, naturally people hate injections. I do personally myself, I do hate injections. Given an option of taking a tablet and getting myself injected, I'll always go for a tablet. Given myself of a spray of an injection, and convinced that the two have equal efficacy, I'll always go for something that does not cause harm, does not cause pain. So yes, this will be very novel if it proves and it stands the test of time. But in the meantime, it's still in the research. We don't have it having been translated into practical use. For the other vaccines with the side effects, I think more than 600 million vaccines have been administered. And I can tell you, the side effects that have been noted were quite few. And most of the side effects that were noted were local side effects that we note with other interventions like medications and other previous vaccines. The constitutional fevers, joint pains, malaise, local reaction where you get the injection. But I think it will be an exaggeration to say that those harmful vaccines, I think at the end of the day, we need to get back to our normal life. And the vaccines seems to offer a platform for us to be able to go back to our life.
Thank you, Dr. Swaleh. Abdul Nasir Muhammad has asked, is it recommended to get the vaccine in Ramadan, considering the non-side effects and impact while fasting?
I don't have any studies or trials to see this. I think this is the first Ramadan that we are facing in the era of the vaccines. Personally speaking, I don't see any problem because, as I said, the side effects are quite minimal. You see, when you talk of side effects, ask yourself, in how many patients were vaccinated did the side effects occur? If you're talking of side effects occurring in few people out of the millions that have been vaccinated, then that's a negligible side effect. It doesn't have to happen to everybody. I got myself vaccinated. I didn't get much side effects. It was the local reaction. I got some pain on my deltoid muscle, but that is it, and I was back to work on the next day. So the side effects are individual and the side effects are rare. Let's agree that the side effects are rare. There has been exaggeration in the social media where people get the vaccine and the next thing is they collapse. And I think that hasn't been reported in all the literature that we've come across. People have had some anaphylactic reaction, very rare, but they are taken care of. So side effects are rare, let's agree on that, and they do not need to occur. Unfortunately, negative things seems to take preference over the good things. The good thing is we are seeing more patients dying of COVID-19 pneumonia. We are seeing our beloved elderly, our beloved parents. We are seeing our grandparents dying. I'm sure most of you have gone to attend to these services, the funeral services, the graveyard services, and you've seen what is happening. So it's in life, it's a matter of benefits vis-a-vis the disadvantages. So my message across is, if we need to get out of our cages, if we need to stop being pets where we cannot move anywhere, it's time now we address the issue quite well. And vaccines seem to be offering a platform for us to go back. So my advice to the person who asked the question, I don't think Ramadan is a contraindication to that. And I don't think it will break your fast. It's not nutritional. It has no nutritional value. But if you feel like it might interfere with Ramadan, you can always postpone until the end of the Ramadan. But the sooner you get it, the better, especially for those who require it, the more vulnerable ones.
Thank you, Dr. Swaleh. Questions from Tonito and Faisal. I think they're interrelated. Allow me to ask them, Dr. Swaleh. So Tonito has asked, who else can take the vaccine? If you have HIV, can you take the vaccine? And Faisal has also asked, should pregnant women be vaccinated?
Okay. Now, the vaccine is actually targeting, because of the low supply, not low supply, but the demand being higher than the supply, there has to be a logical way of giving the vaccine, where we target the ones who are more vulnerable, and more so like the healthcare workers, people who are actually in touch with the patients all the time, and they are at high risk of getting the infection. So those are being given priority to be vaccinated first. Others, of course, are those people who are also working with essential services, the firefighters and all those, the teachers. Again, based on that, there's also the age criteria. The older you are, the more vulnerable you are. So those are the type, if you look at even our national policy, apart from the healthcare workers, our next criteria was age, those who are above 58 years. And it's true, because you cannot give the vaccine to everybody. We don't have vaccines to vaccinate everybody in Kenya. Not in Kenya, even all over the world, nobody has enough vaccines to vaccinate everybody. So at the end of the day, we have to prioritize who are to. If you get an old person vis-a-vis a young person, it is logical to give that vaccine, and you have the choice between the two. I'll give to the old person. Now, coming to HIV. HIV is one of those vulnerable patients who have. So there's no contraindication to HIV. As long as those patients are taking the antiretrovirals, they can be vaccinated and follow the vaccine protocol like any other patient. The only thing that there's other patients who have cancers, patients who have low immunity, it's only that we are not so sure is whether they will be able, especially patients who are using immunosuppressants, whether they'll be able to develop enough immune antibodies against the vaccine or the particle that is injected into them. The concern is not that they should not be given. Our concern is, will they develop enough antibodies? being on medication that are causing immunosuppression. But there's no contraindication to somebody who is HIV positive. Coming to the pregnant woman, we have studies now that are looking at pregnant women, especially in the second and third trimester, because the first trimester is a bit sensitive. This is where we have organogenesis, where organs are being formed. The heart, the stomach, all the organs of the body are being formed in the first trimester, the first 3 months of pregnancy. So this might be a critical stage that we don't want to inject something that might have an effect on the development of the fetus. But on the second trimester and the third trimester, there are trials that are looking at vaccinating pregnant women, and they are at an advanced stage, and I'm very sure if you are to sit down here in the next few months, we'll be able to know whether pregnant women should be vaccinated or not. There are also trials. Most of the vaccines that have been used in the old population. Most of them have tackled above 16 years. So there are trials that are looking at older children and vaccination in them, and I'm sure we'll have answers very soon.
Thank you, Dr. Swaleh. There's a question from Dixon Ayemba. You mentioned the symptoms to look out for if you get the Astrazeneca vaccine. Please advise what other symptoms I need to look out for if I get the vaccine, and advise what to do if symptoms occur after vaccination.
As I said earlier, the common symptoms that are there, not common in the sense that they occur commonly, but the ones that have been observed commonly are symptoms that are related to the injection site, a local reaction. You can get some pain, you can get some redness around the injection site. And other symptoms are what we call constitutional symptoms. Symptoms like malaise, feeling tired, out of energy situation, symptoms like joint pains, symptoms like headache. Sometimes you can get rigors and chills. These are common reactions that we do sometimes to vaccines. And I'm sure for mothers who have given their children vaccines, I'm sure even for our own children, when they get the DPT, that day will not sleep because the fevers will be so high for our kids. They will be so painful on the muscles that will not sleep at night. So those are the symptoms that we are talking constitutional that are related to most of the vaccines that are given to people. The rare symptom that we are talking about, the Astrazeneca vaccine, are the clots. Okay? As I said earlier, these are rare. But the symptoms to look for these ones now are things like, depending where the clot is. If the clot is in the head, they'll come with crushing headache that does not respond to normal paracetamol. So, and they develop usually in the second week. So if you get these symptoms, if the clot is in the abdomen, then you get severe abdominal pains. Okay, that does not respond. If you get the clot in the leg, you'll get swelling on the leg. If you get a clot in the lung, then you'll get difficulty in breathing and some chest pain. So those are the symptoms especially to look for, especially after the first week. They don't occur immediately. They take time to come. The ones that occur immediately are what we call the constitutional ones that can be sorted out at home with paracetamol and rest. Rarely do you need to go and visit the hospital. In the ones that we vaccinated, quite a number of patients, very many hundreds that have been vaccinated, very few have to use paracetamol to relieve their symptoms. The other symptom, the other adverse effect that can be seen that is not related to the vaccine, because most of these vaccines are not live attenuated vaccines. These are the spike, a part of the virus, what we call the spike, okay, at the membrane of the virus that are injected, and those the spike is the one that sort of stimulates immunity antibodies against it. And in so doing, you're actually making your body now protected, so that we have memory cells that will always produce those antibodies when exposed to COVID. Other methods of vaccination are things like we use live attenuated virus, where a virus is weakened to the extent that if it's injected in the body, it does not cause the active infection, but it's able to evoke an immune response. It's strong enough to evoke an immune response, but not strong enough to infect you. So those are called live attenuated vaccines that we don't use them in COVID-19. The COVID-19 have used the vector type of vaccines and also the mRNAs type of vaccine. So some people develop COVID a week later after the vaccination. It's just developing the COVID. Sometimes, as I said, the protection comes 2 weeks after full vaccination, and full vaccination is 2 doses. So once you're vaccinated with the second dose and you stay for 2 weeks, only then do we get that efficacy of more than 80, 90%. But before then, you are still not fully developed the antibodies. The other part is there's this effect that people can have. Once you're vaccinated, we feel that now we can be careless because we're protected. So we start now going into risky behaviors. We remove our masks and we start intermingling, hugging everybody. That type of behavior can actually make you get COVID, especially immediately after vaccination, because your vaccine has not taken off to protect you. So be careful post-vaccination. You have to give the vaccine time for it to work. Even a dose, 1 dose can also help you to give you some bit of protection, but you have to give it 2 weeks before you start becoming confident and start misbehaving.
Thank you, Dr. Swaleh. I think you've touched some nerves of some people because some tend to feel invincible after the first dose. So Kellen has asked, if you miss the first vaccine, can you mix it with the other? I think
That's a good question.
he's asking if you can mix the Astrazeneca with others that might come.
That's a very good question, whoever asked the question. And I can say as we speak right now, this concern is going to be brought because of supplies. We might have differential supplies. We might get AstraZeneca now very easily, but maybe in some few months or some few weeks, we may not be able to get the AstraZeneca, and we might end up now getting the Johnson & Johnson vaccine, or the Sputnik vaccine, or the Pfizer, or the Moderna. Now the question is, can we go ahead and do it? Now the question is, if you're getting a single, the only vaccine that is single dose is Johnson & Johnson. So, in my belief, it may not have any harm to get another vaccine. But the question is, if you're getting another vaccine that requires you to get a second dose, that might become now like a vicious circle, where you're getting the first dose of another vaccine, but you're not getting the second dose of the same vaccine. But your question is going to be answered very soon, because we have trials that are looking at mixing the vaccines, getting the first dose of AstraZeneca and getting the second dose of Pfizer. And this is going to happen. This is a practical question that is going to happen, because supplies are not going to be consistent. Supplies are going to be differential. Whatever we get, we might have to use that. So your question might be answered very soon, but in my humble belief, I think that might be possible with time.
Kellen, I hope your question has been answered well. Percy Mukula has asked, nice presentation, Dr. Swaleh. Will you recommend the vaccine to clients who have hemangioma? I hope I've pronounced that right. Hemangioma.
Yeah, I can see our moderator is really trying to be medical. He's really trying actually. Yeah, hemangioma is a benign tumor involving the blood vessel. You can have a swelling or can have a patch on any part of the body. You can have it on the face. You can have it in the trunk. But it's a benign tumor that is not harmful. Maybe the only problem with it could be issues of cosmetic, if it's on the face, or if it's large enough to cause what we call compressive signs and symptoms. But majority of the hemangiomas are very benign, and there's no contraindication to vaccination for somebody who has hemangiomas.
Thank you, Dr. Swaleh. Mary Kariki has asked, what about our children? When will they also get vaccinated, and at which point?
As I said earlier, most of the vaccines, the Pfizer and the Moderna, tackle from the age of 16 years and above to almost 8 years. None of the vaccine has gone below 16 years. And is it that the children are to be forgotten? No. What we know now is the disease is mild in children. Children are not much more vulnerable than the adults, and we have issues with children sometimes with certain syndromes. But overall, the disease is much milder in children and much less in children. Now the question is, Whether they should be vaccinated, at this point in time, we don't have trials that have gone below 16 years. But I can tell you there are trials going on that are looking at vaccinating all the children, and I'm very sure that we'll have our answers in the next few months once the trials have reached the phase 3 trials to be released.
Thank you, Dr. Swaleh. Suzy Gikonyo has, I think it's a question stroke statement. Has MOH asked the manufacturer for more data? We need it to be broken down by age and sex to look for the more serious and rare side effects that are being seen following immunization. What's your take on that, Dr. Swaleh?
This is what we call pharmacovigilance, and this can occur especially post-vaccination. And it's a very good. It's not a suggestion; it's a requirement. Other countries are doing it. If you look at CDC, FDA, America, they are very aggressive with their pharmacovigilance post-vaccination because these are new things. These are new, like any other new drug that is introduced into this world. There has to be post-marketing pharmacovigilance where we pick these rare side effects. And one of the reasons is people are very aggressive outside, and they are able to pick this rare condition. Okay, these clots. If there was no pharmacovigilance after vaccination, I'm sure these clots will have escaped from our eyes. But yes, pharmacovigilance is a requirement. It's not. We should not only suggest, but we should demand for it to be there.
Thank you, Dr. Swaleh. I think Lynn Kashi has had so much being talked about the blood clot, such that she's asking, is the clot painful?
Linda, that should be among the lower concern about a clot. But if the clot happens in the head or the clot happens in the lungs, then pain is not a real concern. The real concern will be the after effect of that. Like in the brain, if it happens, then severe headache will follow. And of course, the after effect of that is what now will be a concern. If it's in the lung, there could be some chest pain, but more importantly is the breathlessness that might be associated. But as I said earlier, these, I'm still repeating again, these are rare. And even if you look at the literature, they're talking of rare occurrence of clots with these vaccines.
Thank you, Dr. Swaleh. So, Lillian Otenyo, Dr. Swaleh, I got smallpox vaccine some time back when I was young, and I still itch at the site. Is it safe for me to take the COVID vaccine?
Yeah, the question is, most of us got the smallpox when we were young, but we are not itching at this point in time. These are what we call, for you to say something is important or significant, you have to look at the number of occurrence that has taken place against all those who have been vaccinated. Taking one isolate, if I give you, if I make a mistake, if you give me a question, I make a mistake and you give me a wrong, and you give me another question, I make a mistake and give me another wrong, and I give me a third question and I make a mistake and give me a third wrong, that is significant. If it occurs 3 out of 3, that is significant. But you gave me 100 questions and I missed only one, surely I need some compliment for that. I deserve an A+. So this is that we should not look at side effects. Individually, it might look very significant, but when you're interpreting the data, we look at the population level. Out of the 1 million that you have been given smallpox, how many itched many years later? And I can tell you it's very, very rare because most of us are not itching. So that could be unique to you, and probably you might have to use some medication to apply or some antihistamine for that. But it's a rare occurrence as well. So go ahead and have the COVID vaccine, please.
Thank you, Dr. Swaleh. To our viewers, we've managed to steal about 20 to 30 more minutes of Dr. Swaleh's time. I think we have a few more minutes to go, so please ask your final questions now. We have a question from Steve Wausi. Please advise people who have allergies on their suitability for the Astrazeneca COVID-19 vaccine. I think he's referring to the people who have advised. Yes.
Yeah, that's a good question. And I wanted to make it clear that the vaccine do not contain animal products. The vaccine does not contain human products. So if you are allergic to egg, it's not synonymous that you're going to be allergic to the vaccine. It does not contain egg. If you're allergic to any animal product like fish, it doesn't contain the fish component of it. So it's not a contraindication, the fact that you have allergy. But definitely we need to be extra precautionary because some minimal allergic reaction has taken place. So for those who have history of allergy, those are the type of patients who need the observation post-vaccination, especially the first 30 minutes to 1 hour, because most of the reaction will occur immediately. They won't take so much time. Some of the reactions are minimal. Like I said, the local reaction where you feel itchy where you've gotten the injection, those ones can go with some simple ointments, or they can just be ignored or get some antihistamine. But for those who have history of allergy, those are the type of patients, when they're vaccinated, they should not just go home. They should be observed for at least 30 to 1 hour before they leave. Because and in case the allergy takes place at home, you just need to rush to the hospital for it to be taken care of. Most of the allergies are quite mild allergies, and they are well taken care of by medications.
Thank you, Dr. Swaleh. Abdulaziz has asked, what are the cost benefits of COVID-19 vaccination?
That's another very good question. I may not have a scientific answer for that, but I might have a social answer for it. Because for you to say the cost benefit is to you're preventing severe infections. So those with severe infections get admitted. When they get admitted, that's a cost attached to it. Some of them, and most of them with severe infection, will require oxygen. Oxygen is expensive. Hospitalization is expensive. So you're talking of saving all that cost. There are those who have severe infection who end up now having to be requiring mechanical ventilation. Okay? So this is even another expensive issue. So the first direct impact of the vaccines is, and all vaccines, as I said, all the literature in the vaccine trials from UAE, trials from European countries, trials from the US, all those have shown reduction in hospitalization, reduction on severe infection, and reduction in COVID-related deaths. So there's direct effect of preventing these three goals. And there's direct in terms of finance, direct in terms of the number of days that are lost, working days that are lost for these patients, for the patient and for the relatives who take care of their patients. So that is the direct effect. The other effect is, as I said earlier, I feel like I'm a pet in a cage. We want to travel. I was so delighted recently when I traveled outside, and I was so happy that at least I have my life back. And I think that's everybody. We don't want to live in this situation of fear. We don't want to live in this situation of lockdown where one time of the day you have planned to go to Nairobi and the next day you have to cancel your trip because of lockdowns. We don't want all that. We want life to come back to normality. At the moment, we don't have treatment for COVID. The only solution, or rather the only hope that we have, is this vaccine. And hopefully with the vaccines, we'll be able to contain the disease and bring back normality. That is now the social benefit of these vaccines. And to me, that's the most important. I just want my life back.
Sounds like a cage, Dr. Swaleh.
I do.
So we're going to combine two questions, and I think I'd like to urge the viewers to ask as many questions as possible, which we will forward to Dr. Swaleh to answer later. I'm combining two questions, Dr. Swaleh. One from Lynn Gashin. Is it advisable to continue taking vitamin C supplements or any related immune booster after receiving the vaccine? And Alvin Gilo has asked, in anticipation to having clots after vaccination, is it okay to take aspirin as a thinner? And final question from Anne Karanja. My question on clots, if it occurs, does it cause permanent damage?
Okay, now let's tackle the first one, the vitamin C supplements. It's not a requirement that once you've had your vaccine, then you should take the supplements. It's not a requirement. And even in the treatment of COVID-19, the supplements are not directed towards the virus itself. The supplements are just to boost our immunity. Majority of the time, it's our immunity that overcomes and clears the virus out of our system. So those vitamin C, vitamin D, people have done studies and have shown that in our population, there are quite a number of patients who have deficiency in these vitamins. And the deficiency itself now makes our immunity weak. So by giving supplements, it's simply to boost our immunity to be able to clear the virus very fast from our system. The second question was about aspirin. and taking aspirin after the vaccination. As I said earlier, this is a rare condition. I'll only be concerned with those patients who have had a clot before. And if those patients have had a clot before and they have an alternative to get another vaccine, I'll advise them get another vaccine. But for now, the available one is this. But for those who have had a clot, then that's a concern, and probably not a concern really, because we still don't have a causal relationship between the vaccine and the clots. We are still going on to find out what is really, is there a causal relationship, or was it a mere coincidence that occurs? What we call sometimes, mere coincidence that it happened. And I said earlier, these clots have always been happening. We've always had these clots before. And even one of the guys who asked the question has had a clot herself. So these clots have been there. The fact that it was found in 169 patients out of the 34 million people who received the vaccine, is there now a causal relationship between the two? We are yet to find out. No scientific body has come out to say there is a causal relationship, that the vaccine is the cause of those clots. So precaution for somebody who's never had a clot is not a requirement. And if we are to take a precaution, I don't think aspirin would be good enough to prevent that.
Thank you, Dr. Swaleh. To our viewers, maybe we can give Dr. Swaleh the opportunity to talk about how available he is, in case you want to reach out to him and his clinic. Dr. Swaleh.
Yeah, I mean, for us, even during, I think this is not our first occurrence in the Facebook. We've been doing this since early last year. And and I'm sure if you were to boost our memories quite well, we've been telling you that we'll go back and we'll live with Corona. And we are living with Corona since then. We've been in the hospital, we've been taking care of our patients, so we have to live with Corona. We cannot say life has to stop because of Corona. And one of the ways, of course, to live with Corona is to tackle it through this vaccination and all that, so that it becomes a history. The human species is a very strong species and has the right to exist in this world. It's had a lot of challenges, this species, from before. We've had challenges from other pandemics, other epidemics, and we've come out of those challenges. So this is one of the challenges we have right now, and we have to play our part to take care of this challenge so that it can become a history and it can become one of those memories that we can always talk to our children and grandchildren. So here we are available in the hospital. We never cease with our services. We are available for consultation, available for inpatient services. And for those who might have even further questions, we have an able IT team. They have given you the email to address your questions, and we'll try our best in our future Facebook live sessions to be able to address those questions within the context of our discussion.
Thank you, Dr. Swaleh. Please tell us about your clinics, when you are available, and if somebody wants to see you, what do they do?
Yeah, our clinics are available in two ways. They are available on appointment as well as walk-ins, especially for those who have emergencies. We don't chase you away because you didn't have an appointment. And we're available from Monday to Friday, okay? From 8 o'clock onwards. We close the door once we've seen the last patient. And for those who have emergency, we always advise them to rush to the emergency, where we have doctors there who can take care of the initial emergency. They can always contact us within, and we can be available for emergencies. And as I said, for emergency, we're available 24/7. And you just need to go to the hospital, and you just need to ask for the services, and they'll be given 24/7.
Thank you, Dr. Swaleh. To our viewers, we have come to the end of our Facebook Live session. Would like to inform you that our next Facebook Live session will be in 2 weeks' time. We will communicate to you the topic of the next Facebook Live session. For now, we know Dr. Swaleh is very good in Arabic. We'd like him to say Kwaheri in Arabic so that we can close the session. Dr. Swaleh, over to you.
I don't know whether this insistence from my moderator is for him to pick a few Arabic words for the audience. But what I can say is shukran, and I say ma'asalama, peace be upon you. Keep safe, and together we shall overcome this pandemic. Thank you.
Thank you all. See you in 2 weeks' time. Bye-bye.